The county of Makueni, where our reporter Cecilia Wakesho is. April the 7th will be the World Health Day, and this year's theme is universal health coverage for everyone, everywhere. Now, the ultimate aim of this day is to celebrate the day and work towards ensuring that we have a world where everyone has access to the healthcare services they need without having to worry about going into debt paying for them. Now, half the world is currently lacking access to appropriate medical services. The organization reports another 100 million people have been forced into poverty from paying for medical bills or services. And as the day comes close, a two-day conference on universal healthcare organized by Vision 2030 Secretariat. The conference is currently being held at the Makueni County. Let's cross over to our reporter, Cecilia Wakesho, who's now joining us live from the county of Makueni. Cecilia, definitely a very timely conference, but what are some of the engagements that are currently ongoing there?
Well, thank you very much, Kisa, and indeed this is county number 17 stakeholders meeting here since morning. Actually, the conference, two-day conference that has begun today is underway, where stakeholders from different 47 counties are gathered here talking about the universal healthcare, this being the World Health Week. Remember, Akisa, this Makueni County has been seen to be sort of a model county after in 2016 it came up with a way of providing healthcare to its citizens. Up to 72,000 citizens have been reached so far, and it's a model which seems to work, whereby families, a parent goes and registers for only 500 shillings, and after that, that is annually, 500 shillings annually, and after that, the whole family, including children of 18 years and 24 years for the students, they are all covered in this universal healthcare. And perhaps this is why the Vision 2030, AMREF Health Africa, together with the Makueni County government, chose to have this conference here, whereby tomorrow we are expecting President Uhuru Kenyatta to come and close it officially. Remember, he has mentioned that one of his 4 key agendas is achieving healthcare for all by 2022, and so probably when he comes here tomorrow, he'll have to borrow 1 or 2 things from the stakeholders who are here. But perhaps to elaborate on what has been going on and perhaps how we are going to achieve universal healthcare across the country, because President Uhuru Kenyatta has said for him, he plans to leverage on the National Hospital Insurance Fund. Then I'm joined by one Githinji Gitahi. This is the chairman, or rather is the boss of AMREF Health Africa in Africa. He'll be telling us perhaps how we can achieve this, how President Uhuru Kenyatta can borrow this. So welcome very much to KTN News. I want us to talk about earlier on while we were in the meeting, you had talked about how Laikipia County, AMREF, you're working with it to see that NHIF reaches everyone. So how can this be borrowed by the national government to see that by 2022, every Kenyan is able to have access affordable health care?
Yeah, thank you very much. I would like to address myself to the president, actually, because he is a champion of universal health coverage. And I would like to address the president both as an empowered, knowledgeable citizen, but also in my role as AMREF Health Africa and also on the UHC 2030 global agenda. I think the first thing I would like to say is that it's a major step for the president to make the remark and the declaration that UHC is going to be one of the 4 pillars. That's a major step, and that's what we are hoping for. Now it's happened. I think the question is now, how do we move forward? The within that declaration has also identified the NHIF as a key instrument to help us achieve that. Because when you talk about UHC for Kenyans and health for all, it's about first deciding what you want to offer the people. What kind of health do you want the people to have? And then how do you finance it? And then how do you hold the people providing it accountable? So the first thing that I would like to really address myself respective to the president is this country needs to decide what benefit package, what health benefit package we are giving our people. Without that, then we face the danger of directing finances at the name UHC, when actually the name UHC is just a terminology. We must decide what it means for us. And therefore, once we define that package, we then direct our finances directly to that package we offer the people. How to finance it? We've agreed NHIF is one of the biggest tools. Now, for us to achieve that, there is a challenge. And the challenge is what we call the informal sector. The people who are not formally employed. You and I pay NHIF through our taxes. But there are people who can pay for NHIF, but they are not employed formally, so they don't have a pay slip. That particular population is big in Kenya, because Kenya has probably less than 30% formally employed population. So how do we reach these households so that we can achieve the president's agenda to have everyone covered by NHIF by the year 2022? What we did is talk to Laikipia County and said, can we use your county as a test model? And we are going to use a very important cadre of healthcare, which is called the community health worker. The reason we are using the community health worker is because the community health worker is the most trusted person in healthcare in the community. Because they live in the community, they are trained and they work with the people day to day. How can we use these community health workers to then also approach the households to explain what NHIF is, what the benefits are, and also we allow them technologically to receive money daily, weekly, monthly, quarterly, annually, so that they can actually enable the communities to pay as and when they get the money. And finally, we allow the community health worker to also be the link between this family and the facility when they are sick. So there is a trust that you're creating in the community, and through that we've visited over 60,000 households in Laikipia, and out of this, of about 20,000 of them are part of health insurance now. So it is a model that we can follow. And then in that model, you also identify the people who are poor, who then the government needs to pay for through a subsidy. So that is how the Laikipia model is working. And we are now looking at Makueni. We've talked to the governor in Makueni. We are getting to Makueni. We are getting to Vihiga. We are getting into many other counties that have approached us for this model. Yes.
Thank you very much.
Thank
and
you.
wish you all the best. Akisa, you have had it there. Laikipia County is one of the counties that is as well being used as a model county in as far as achieving the universal healthcare by 2022 and by extension for Vision 2030 is concerned. But it is important to mention that here in Makueni County, earlier on we had talked to the governor, Kivutha Kibwana, who was saying that so far, even elderly people 65 years of age and above, so far they don't pay even a single cent when they go to the hospitals, and this is on top of the 500 shillings annually registration for universal healthcare for citizens here in Makueni. But remember, he said that he will have in future to as well work with the national government as far as the NHIF is concerned, because it's something that they can't wish it away. And he was saying that, for example, right now what happens, this universal healthcare only provides for the basic health services, maternity, that is the free maternity. We have the dispensaries that offer basic services. But when it comes to services like surgery, post-mortem, these are services that then will not be offered, will not be inclusive in the 500 shillings annual registration fee. So you can see this is something that will have to be expounded, and they insisted that this is a journey, this is not a destination. It is something that they'll have to work bit by bit, because even globally research has shown that even countries that have provided universal healthcare, it's not easy to achieve 100% of it, because there are usually areas that still have gaps. So Akisa, this is something that we shall be following on, even as President Uhuru Kenyatta is expected here tomorrow, and we'll keep our viewers updated.
Very much, Cecilia Wakesho, for us there in the county of Makueni. Conversation